Now, private clinics have got 24 hours to tell the Department of Health how many women have had those PIP breast implants and how many of those have actually burst or ruptured. I'm now joined by Melanie Schilling, who had this procedure 3 years ago and says she feels like she has a ticking time bomb inside her own body. And Dr Hillary joins me as well. Melanie, what a nightmare, absolute nightmare. You must be on pins all the time, just being really scared.
Scared and nervous
and
just petrified.
So you had this done how long ago?
2008, so 3 years.
2008 you had done. For what reason? What was it for?
I had 3 children and then decided to replace what the kids basically had ruined.
Sure, you just wanted to, as many women do, you just wanted to have that done.
Yeah.
When you had the operation done, did anybody sit you down and say, look, you know what, there are some side effects here, there might be some problems? Did anybody say that?
Yeah, they always touch on the risks and what possibly could happen. But I obviously did the research into, you know, the clinic and the doctor and trusted what they said about the implant that was actually going to be used.
Now, you were OK until a few months ago and it started getting
just painful? Over 4 months ago I started to get pain and since then it's just gradually got worse.
Is it sore right now? Is it
painful? It
all the time?
Hurt. Yeah, it's all the time.
Very, very difficult. So that obviously impacts on your life. You know, you've got a couple of kids.
Dramatically, really,
you know, you think about it, if you're in pain, you don't want anybody anywhere near you.
Don't want anyone near me, and it does make you quite miserable as well. It's like being a bear with a sore head.
Oh, that's really hard because, I mean, you don't want to cuddle off your husband, you don't want to cuddle off your children, not able to exercise or anything like that?
No, I've had to give up doing yoga and running and going to the gym now because I just can't. It's just too painful.
So what sort of treatment have you had? Presumably you've gone to the doctors, and what have they said?
Yeah, I've gone to the doctors and I have been started on a couple of different medications which don't seem to be helping, to be honest. And then I've got to have an MRI scan as well, so that's on Tuesday. So
I'm gosh. Will that tell you whether you've got these and whether or not what
I've
happens?
Definitely got them. I definitely have the PIP implants.
So you know that?
Definitely.
You know that you've got those. So, again, it's really worrying because you don't know, you're reading all of this and just getting
it's just
scared.
Scary. It is. It's very, very scary times at the moment.
That's really, really awful. Hillary, unfortunately, a lot of women are going to be in this position. They're going to be scared, they're going to be worried. What should they do?
Sure, about 50,000 women in the UK had breast implants with using PIP implants. And if they're worried, first of all, they should check with the surgeon or the clinic who put the implants in whether they have these PIP implants, because these are the ones that had faulty material within them, industrial-grade silicone rather than medical silicone. Having said that, we have no scientific proof that it's toxic, although it's not nice to have a foreign body like that in your body, not knowing what it's doing.
Absolutely.
OK, so if you're not sure, find out what kind of implant you had. If you've got a PIP implant, the next thing you should have is an ultrasound test, which is non-invasive, very quick, very inexpensive to do, and shows whether they're leaking or not.
Is that easy to do? Can you get that on the NHS, or will you have to
Yes, you can. A sympathetic GP will say, you know, go back to the private clinic, but it's negotiable, let's say, OK? If you've got one of these implants and it's not leaking, it's not really urgent to do anything at this stage. You need to find out as much as you can. We need to look at the evidence that we're going to be provided with in the next few days about their safety or their potential to cause harm. But if they're leaking, they definitely need to come out. Not just the one that's leaking, both of them. So hopefully the private clinics will show willing and provide information for free. But of course, they're commercial organisations.
Yeah, they don't have to, do they?
They don't have to. I mean, if you go to a bank or a solicitor and you ask for a report from 7 years ago or a bank statement, they're going to charge you, and so can the private clinics.
Presumably they'll charge you to take them out.
Yes, they will. I mean, it's an operation, it's an anaesthetic. There's a risk in removing them, you know, and this is the problem. The story goes on and on. But if they're leaking, they should definitely come out. The question then is whether you have another implant put in and who pays for it. These implants here are high standard and just to the extent that they have a lifelong guarantee.
They're also incredibly large.
Well, this is a larger one. I mean, you choose a different size depending on your shape and size and what you want, but there are different volumes and different shapes of implant you can have. But these are much safer than the PIP implants that have been incriminated.
If you were going in for that operation, you didn't go in there saying, "No, I'll have this implant," because you don't know.
No, you know, there wasn't anything on offer. It was basically that's what they're using.
How do you feel about what's inside you right now?
Oh, if I could take it out myself, I would, but I can't. I just want them out.
Yeah, so as soon as you get that scan, even if it finds out that they're not leaking or anything, are you still want them out?
I'm having them removed because at the end of the day, they're non-medical grade and I don't want that in my body.
No, exactly. I can completely understand that. We've got a statement here. It's from the Independent Healthcare Advisory Service, and they're saying, following an audit of our members, because obviously they're speaking for, you know, the people that are in that organisation. We can confirm that the average rupture rates reported for PIP implants is within the industry standard of 1 to 2%. Now, that's what they're saying, but that doesn't really stop people worrying, does it?
Of course it doesn't, because 1% is still a risk.
Exactly.
And we have heard rates in France of 7%, and some clinics in very small samples in this country saying 7% here. Actually, in Australia, in Europe, it does look about 1 to 2%, but we need to look at further evidence.
They would have thought they were all right.
Yeah,
presumably
they were approved.
Yeah,
they were approved by regulatory authorities, but then they changed the material they were using without consent, and that's where the damage was done. What I would say is that this just goes to show that we need more regulation of the cosmetics industry. How many times have you and I sat on this sofa discussing this? And we're not just talking about breast implants, we're talking about fillers, we're talking about Botox, who's given by people who are not qualified to do it in surroundings that aren't suitable.
Absolutely.
Needs regulation.
Well, I wish you all the very best.
Yeah.
I hope you get it all sorted out, and you know, and everything is all right, because you can't live like that in constant pain. It's not fair.
No,
it really isn't. I really hope you get it sorted. Love.
Thank you.
Thank you for coming in. Thank you, Hillary.